We went into this project with high hopes, having a certain level of certainty that the Perley was going to be a great partner.
Perley Health recently partnered with the Public Health Agency of Canada, also known as PHAC, to combat one of the top threats to public health around the world, antimicrobial resistance. To understand the project requires some context. Antimicrobials are the class of drugs used to treat infections caused by bacteria, funguses, viruses, and parasites. Penicillin, the first antimicrobial, was developed about 80 years ago. Since then, antimicrobials have helped to save millions of lives. As the use of antimicrobials grows ever more common, however, many microbes develop resistance. As a result, there are no longer effective treatments for many types of infection. Reducing the unnecessary use of antimicrobials is a proven way to combat this threat. Together, PHAC and Perley Health developed communications materials to reduce the unnecessary use of antimicrobials in long-term care homes.
Urinary tract infections, they're one of the most common infections that you'll see in long-term care homes, and they're one of the most common infections that are being treated through the use of antibiotics. That you see a lot of antibiotics misused.
In this PHAC-led project, Tanya and her team co-developed and refined a series of materials to educate caregivers, including non-professionals such as family members, about how to best treat suspected urinary tract infections. The materials included this video.
We all have a part to play to keep older adults safe. As an essential care provider, your support and engagement are vital.
Those documents that the Perley as well as PHAC sort of collaborated on ended up being much more useful and audience-specific and targeted. So overall, the products were much stronger.
I was happy with how it went because we did involve a lot of staff in creating those training materials. It wasn't just PHAC, it wasn't just myself and the team. We actually involved the families and the nurses on the unit who would be using those tools.
PHAC is now sharing the materials with long-term care homes in 5 provinces and will closely monitor impacts. Meanwhile, Tanya Paolini and her team continue to work on reducing the unnecessary use of antimicrobials for all types of infection among Perley Health residents. The initiative, known as antimicrobial stewardship, involves everyone from frontline caregivers and healthcare professionals to residents and family members. It also involves Dan Dalton, a clinical consulting pharmacist.
What Perley Health is doing is leading the way by having a program where we're focusing on first making sure that infections are identified properly, and then we make sure that we're choosing the right antibiotic to treat those infections, and we're using the correct antibiotic, the correct dose and the correct duration, as well as monitoring the outcome to ensure that the antibiotics used are safe and effective.
We are seeing change in their practices right now. We're seeing a decrease in the antibiotics. We're seeing a decrease in duration. So we are seeing that impact.
To help other long-term care homes achieve similar results, Perley Health will share the best practices developed through the initiative.
It's a huge change. It's a change trying to change people's mindsets because people still tend to believe that antibiotics are the cure for everything.